Many of you worry about what should we be doing for navel care in the calves. And the most important thing about navel care is clean navel, clean bedding. If you have more than 5% navel infections and or hernias or a mixture of the two, probably it is worth considering having disinfected navels. But I want you to take away that disinfection is not the be-all and the end-all. All right, if the navel is dirty, if the navel has sand on it because the calf was born in a sand calving stall, don't dip that navel. If you're going to dip that navel at all, you need to make sure it's clean. Take the sand off it, okay? Because we're looking at astringents and, in the case of iodine, mild cauterization, okay? And we don't want to cauterize a dirty navel, all right? If you think of it as astringents and cauterization, you'll also know that the target is the cord. It's not the skin. I don't want an irritated navel. That's one more chance to get a bad navel. So I honestly don't want to see iodine from the scrotum, in this case, all the way up to the chest. I want to see iodine on this cord and at the base where it's going into the abdomen. If there's no navel, don't squirt anything in there, okay? So many people agree, and in this study by Dr. Grover, he prefers a dip. But a dip, a spray bottle, if you're going to go ahead and do it, what I would say to you is that it's not just a one-time dip. You dip, 12 hours, you repeat the treatment of the cord. Dr. Grover suggests, and many people do this, that in the case of a long cord like this, he likes to snip it, okay? I'm leery to tell people to snip it unless I say do not go shorter than 2 inches, but 2 inches when it's wet is apt to shrink up and be almost nothing. So if you do cut the navel to make it easier to dip it, make sure, first of all, that you use clean scissors, not the scissors that are out in the workshop, not the scissors even that cut the construction paper in your kid's school drawer, okay? Scissors that have been sitting in an Olvacid solution or chlorhexidine solution, and ones that you can pick out and are clean. I prefer that if you snip a wet navel, don't snip it shorter than 4 inches. And that's very easy then for a calf that's sitting up to go ahead and dip it, okay? So this is stiff now, so it's going to be hard to dip. But when you dip, you're really after that navel. And I take this and put that in there, and then it's dipped, okay? 12 hours later, I would repeat it. I don't want iodine or disinfection inside the belly of the calf. This navel is well healed, okay? So there's not an issue. But if that's open, if something's coming through there that you can't tell what it is, don't get anything on it. None of this stuff, even though it's a disinfectant or an antiseptic, it doesn't belong inside the abdomen. What about if they do get infected? Work with your veterinarian on a good protocol, because anything we use for antibiotics for navel care is going to be extra label, and it's really important that we have proper withdrawal. So what I'm going to tell you about navel infections, typically 2 or more bacteria are there because they really came from the calving pen or wherever the calf was born. One is the typical pus former in a cow, and it's called Arcanobacterium, but without exception, penicillin is very effective for that, okay? Unfortunately, it's not the only one there, and 80% of the calves also have a coliform or an E. coli of some variety. It could even be a salmonella there, okay? So in addition to penicillin, my protocol always has another arm of the treatment that must be able to get the gram-negative bacteria like the coliform. So in my protocol, it'll be a combination of penicillin and XNL or Naxal. And so that combination gets quite a big range of bacteria, but make sure you work with your veterinarians on that. There are people who do like just the gram-negative coverage, people who find that just the penicillin works, okay? But when they're young like this, I think the combination is good. We have the people who are screening calf health feel the navels of calves at 7 and 14 days of age. If they're wet, if they cause pain, or if they're thicker than a thumb after the first week, then I want you to make sure that you're watching them closely, or that's the time to get in and get them treated.